Did you know fever during pregnancy can lead to complications? Fever during pregnancy is not just another typical ailment. It's indeed a concern that needs attention and caution. It presents potential dangers not only to the expecting mother, but also to the unborn child. But why does fever occur during this vital period? What factors are for it? And most importantly, how can an expecting mother manage it effectively? What steps can she take to prevent it from occurring? Is it completely preventable, or are there uncontrollable factors? Today, we delve into these questions. Fever during pregnancy can be triggered by various factors, most commonly viral or bacterial infections such as the flu, urinary tract infections, respiratory infections, and other illnesses. It's not the fever itself that's the concern, but rather the underlying cause of the fever. The potential risks associated with fever during pregnancy are significant. Particularly during the first trimester, a high fever can potentially increase the risk of birth defects or complications, such as neural tube defects. What's more, fever during labor can also heighten the risk of complications for both the mother and the baby. So, what should one do if they develop a fever during pregnancy? The first step is to contact a healthcare provider promptly. They can assess the situation, identify the cause of the fever, and recommend appropriate treatment or management options. Treatment for fever during pregnancy is typically determined by the underlying cause and the severity of the fever. It may include rest, staying hydrated, and taking over-the-counter medications like acetaminophen under the guidance of a healthcare provider. If the fever is due to a bacterial infection, antibiotics may be necessary. And how can fever during pregnancy be prevented? The best protection is through practicing good hygiene. This includes regular hand washing, avoiding contact with sick individuals, and getting recommended vaccinations such as the flu shot. Notably, during a fever, pregnant individuals should also pay close attention to fetal movement and report any changes to their healthcare provider. In some instances, fever during pregnancy may warrant closer monitoring of the baby's well-being through methods such as fetal monitoring. In summary, while fever during pregnancy can potentially lead to complications, understanding its causes, knowing the risks, seeking prompt medical attention, and following appropriate treatment can help manage the situation. Prevention through good hygiene practices and monitoring fetal movement can further ensure the health and well-being of both the pregnant individual and the baby. Remember, knowledge is power, and staying informed is the first step towards a healthy pregnancy.